Hi everybody, welcome to another installment of our email educational series called Happy Tears. This comes from mydryeye.com, where we try and educate people on all things dry eye disease. Today we're talking about chalazion. Now, chalazion are a very common condition, but I think a very misunderstood condition. We're going to look at the anatomy, we're going to look at the pathophysiology of chalazion. Now, the normal tear film comprises of two layers, the mucoaqueous gel layer and the lipid layer. The lipid layer is made up of meibum. Meibum comes from meibomian glands, and these are situated in the eyelids. So on cross-section, when you look at it from the side with the eye looking from the left to the right, there is a cartilaginous plate in the eyelid called the tarsal plate, and within that are these little meibomian glands. They produce the meibum, and if we look at the eye from the front, you'll see there are about 35 little glands along the upper lid, around 25 on the lower lid, and these produce the meibum that seal the tears. During a condition called meibomian gland dysfunction, either poor quality or quantity of meibum is produced, and ultimately the opening of one of the meibomian glands becomes blocked. When this is blocked, the gland continues to produce meibum. The meibum causes the gland to swell, causing some discomfort, and as it swells, it becomes more porous, and some of this meibum leaks out into the surrounding tissue. This causes an inflammatory reaction in the body, and patients present with acute pain, swelling, redness. It looks classic like an infection, but it's actually just cellulitis from the body responding to this leaked out meibum. What the body cleverly does is it recruits cells called fibroblasts that come and pack around this leaking oil to stop it causing more inflammation on the tissue in the eyelid. These fibroblasts pack around it and form a firm lump. This is the first time patients will start to feel a little bit of relief. Now, once there's this firm lump, it consolidates a bit, and one of three things can happen. Either it'll stay like that for a while, secondly, it'll slowly be absorbed, or thirdly, it'll kind of be taken to the edge of the eyelid and it'll discharge. Usually it goes towards the palpebral conjunctiva, so the back end of the eyelid where it presses against the eyeball, and will discharge from there. Many patients will say, oh, I woke up with a gunky discharge, my eye felt a lot better and has continued to get better ever since. But if it doesn't, if it stays like a firm, hard P shape under the eyelid, the redness and inflammation goes away because it's all been trapped or contained within the fibroblast capsule. And slowly the body will then send in things called macrophages. These are kind of vacuum cleaner cells that will go into the meibum and slowly absorb it. And gradually over a couple of months, it will get smaller and smaller and smaller. And eventually it will go away. And what can remain when this area heals up with some scarring is a little notch in the eyelid. So that may be one of the telltale signs that a person has had a chalazion. These notches can be problematic when they're in the lower lid in particular, because they sort of form a gutter, allowing water to spill out over the eyelid and down the eye. Also, they cause misdirection of the lashes, so the eyelid's a slightly different shape, and as a notch cap happens, these lashes turn towards the patient's eye and can rub on the cornea. So chalazion can cause symptoms that are suggestive of dry eye disease, and in fact quite likely are associated with meibomian gland dysfunction, the leading cause of dry eye disease. So although chalazion per se is not dry eye disease, but the underlying condition, meibomian gland dysfunction, are one of the key causes of dry eye disease. My treatment advice is always hot compress and massage. And I get a lot of patients coming to me, usually being on 2 courses of topical and even oral antibiotics from the GPs because of the concern about preseptal cellulitis. And I think that's reasonable to treat the patients with antibiotics, although in true chalazion, where there's no infected element, then it doesn't really solve the patient's problem. Now, in some chalazion, it's obviously a warm, dark environment, energy rich with all this meibum. If a bacteria has managed to get into that area, yes, well then you are going to have a pussy discharge and quite an acute bacterial infection within this chalazion. and they tend to erupt with a lot of pus and can actually have the patients feeling very unwell. So in particular cases, oral antibiotics are indicated, but I'd say the vast majority of cases I see don't need oral antibiotics and respond very well to an anti-inflammatory, hot compress, and massage. So thank you.